up for good thing, yeah. Baby, I'm sorry, I be all up in my feelings, yeah. Baby, I'm sorry, I'm just working on my healing, yeah. But none of that matters to you, 'cause you love me, baby, yeah. 'Cause you love me, baby, alright. Even though I drive you crazy, 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 you love me, baby. See, every time that I get down, when this life makes me doubt, you always know just what to say. You be quick to pick me up, quick to show me love, and I promise I won't let it go to waste. That's why I'm sorry, I mess up a good thing, yeah. Baby, I'm sorry, I be all up in my feelings, yeah. Baby, I'm sorry, I'm just working on my healing, yeah. But none of that matters to you, 'cause you love me, baby, hey. Yeah, 'cause you love me, baby, hey. Alright, drive you crazy, crazy, crazy. You love me, baby, you love me, baby. 'Cause you love me crazy. You're out of this world. You love me crazy. You're out of this world. Love me crazy. You're out of this world. Love me crazy. And I wanna make your body say, ooh, 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 ooh. See, I'm trying to make your body say, baby. Even though it's 10 in the morning, trying to make your body say. See, I wanna make your body say, baby. And I'm just trying to make your body say, na, na, na. I'm trying to make your body say, na, 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 na. See, I wanna make your body say, see, I'm trying to make your body say, baby. Hey, can I get everybody to say? Can I say, hey, 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 hey. Come on, say it. I hear you. And you sound so good. One more time, say, hey, 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 hey,
It's hot.
Listen. Why can't you just admit it? You've been trying to act dismissive all night long. See, you're trying to be responsible, yeah, that's commendable, but a love like mine will wait too long. See, my love is for the taking, yeah. If you want it, gotta say it, yeah. Keep it real and please don't fade, and I will too. See a love like this, you gotta get it while it's hot. Young heart on fire, promise you won't blow it up. Baby, I can feel the key, trying to turn it up a notch. Feel, yeah, a love like this, you gotta get it while it's hot. Young heart on fire, promise you won't blow it up. Baby, I can feel the key, trying to turn it up a notch. Oh, can't you feel the tension? Pick up on what I'm giving. Are you too blind? Baby, see your patience is respectable, and I love that you are rational. But sent by too long and I'll be gone. Yeah. See, my love is for the taking. Yeah. And if you want it, gotta say it. Yeah. And keep it written, please don't fake it. And I will tell. Yeah, love like this, you gotta get it while it's hot. Young heart on fire, promise you won't blow it out. Baby, I can feel the key, trying to turn it up a notch. Feel. Yeah, love like this, you gotta get it while it's hot. Young heart on fire, promise you won't blow it out. Baby, I can feel the key, trying to turn it up a notch. So can't you feel the heat now? 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 No. So we gotta take care of our minds now. We gotta take care of our bodies now. We gotta take care of our souls before it's all gone. So we gotta take care of our mind. Gotta take care of our bodies. Gotta take care of our souls. 'Cause one day it'll be gone. Hey. No.
Super excited to be a part of re-enrollment for Foundations Community for 2022. Super honored to be here in front of all of you, and super honored to introduce Deputy Executive Director of Foundations Communities, Julian Huerta.
Wow, that's the coolest introduction I've ever had. Thank you. Good morning, everybody. Thank you for joining us today as we kick off open enrollment for 2022 Marketplace health plans. Many thanks to Alejandro and Drint for the sweet vocals. It's so great to include music in this event today. Alejandro has been a part of the Austin music scene since 2014, playing with his band Black Odyssey and others. And he's also been a Foundation Communities and HAM client since 2019. And we'll get to hear from Alejandro a little bit more in a bit. We have a lot of good news to share about open enrollment this year. But before we get started, I do want to mention our other special guests that we have today. We have Mayor Steve Adler, Councilmember Greg Casar, and also our Congressman, Representative Lloyd Doggett, who we'll be hearing from in just a bit. So hopefully you know about Foundation Communities. We provide housing for about 7,000 of our neighbors, but we also help people throughout Central Texas improve their financial stability. And one thing that we learned in doing that work is that for many of the folks that we serve, medical debt is their biggest source of debt. And so we know that not only is health insurance important for health reasons, it's also an important economic tool. And so that's why we do this work. So we are the largest nonprofit healthcare enrollment organization in Central Texas, and I think it's safe to say one of the biggest in the country. Since 2014, our incredible team of staff and volunteers have helped over 45,000 people enroll in health insurance, and we have helped them save almost $250 million through credits and subsidies that apply to their premiums and other costs. We have some exciting changes for this year. So open enrollment started on November 1st and is going to go through January 15th of 2022. That's an extra month over what we typically have. We're also really excited that we're going to be welcoming clients back into our Prosper Centers for in-person appointments, although we will still maintain telephone appointments for people who want those. We're extending our outreach to 12 counties in Central Texas, and we can provide you with a list of those. And we're stepping up outreach in communities that have high numbers of uninsured folks, because always our goal is to simplify the process of signing up for health insurance so that people can stay healthy and know that and have the peace of mind that comes with having health insurance. Many things are still the same about this enrollment season. Financial help is still available to help people obtain coverage, and about 95% of the folks who we help get some kind of assistance in paying for their coverage. Pre-existing conditions are still covered, and 10 essential health benefits can be found in every Marketplace plan, as always. I'm really pleased to say that more plans are available than ever before. So there are 15 insurers offering plans in Texas compared to just 10 last year. In our 12-county outreach area, people will have more plans than ever to choose from. So that ranges from 57 plans in Blanco and Gillespie counties all the way up to 162 plans in Travis and Williamson counties. Our staff and volunteers are ready to help simplify the process so it's easy for folks to find and choose the best healthcare plan for them, right? I also want to point out a couple of benefits of the American Rescue Plan. More financial help is available than ever before to bring down the cost of premiums and care, and more people are eligible for financial help, including those who were excluded in the past, okay? I do want to also mention our great partnership with HAM, the Health Alliance for Austin Musicians. Last year, HAM and Foundation Communities assisted nearly 2,100 musicians in enrolling in health coverage. And in 2020, HAM members saved an average of $605 a month on their insurance premiums through credits and premium assistance. So we know that musicians are small business owners, and this is a great opportunity for them to get health insurance they might not otherwise have access to. So in sum, we're here to help. Enrollment runs from January 15th until January 15th of 2022. Enrollment help is available in person at our 2 Prosper Centers and by phone. It's easy to make an appointment, just calling 512-381-4520 or signing up at prosperhealthcoverage.org. Our team of experts will help you find a plan that meets your healthcare needs and budget. So I do want to say thank you to some important folks. So first of all, of course, thank you to Mayor Adler and Councilmember Casar, Congressman Doggett for co-hosting this event for us and helping us to get the word out. We want to thank the City of Austin, Central Health, St. David's Foundation, and the Episcopal Health Foundation for their generous and ongoing investment in the work that we do. And we also recently won a 3-year, $3 million federal grant from the Centers for Medicare and Medicaid Services that's going to allow us to expand our program, and so we're really grateful for that. This has also helped us to increase our workforce with good-paying, full-time, benefit-eligible positions that are doing really important work in our community. And we are still recruiting for those positions, by the way. So now I'm going to go ahead and transfer it over to Mayor Steve Adler, who has some remarks for us.
You know, any press conference that starts off with music in this city's got to be a wonderful press conference. Alejandro, thanks for that. That was great, guys. That was great. The only thing wrong with that music was background vocals by Councilmember Casar and me. I'm hoping no one had their cameras on during that portion of the presentation. All right, so the message here today leading from this that I hope you all lead with is actually pretty simple. There is now more help for more people with more money. This is an expanded time. It's an expanded pool of people that can access the assistance, and the assistance that's available is greater now than it has ever been before. It is more help for more people, and it means more money. You know, I want to speak just real fast to the parents that are going to be watching this, and I just want to say that in our state, we have more uninsured and underinsured children than anywhere else. As a parent, making sure that I am protected is some of the most important things I can do for my kids. That my partner is protected. One of the most important things we can do for one another and for our kids. There is a unique opportunity here, and it is easy, and it is something that anybody in this city can afford and have access to. So I'm urging everybody to do it. I want to thank Julian for the work at Foundation Communities. Just such an incredible asset. What you do in your mission, you do better, I think, than anybody else does in the country. I also want to thank Foundations Community for putting their shoulder toward the summit plan and homelessness, getting people off the street, participating in the overall data collection that we're doing as a community. Obviously, the work that you've been doing in this area and around this area has been significant for a long period of time, but I want to say thank you for that. Please thank Professor Moreau, who's off teaching right now, for us. I want to thank Congressman Doggett. A lot of the more people, more money, greater period of time is the work that he's been doing on the Ways and Means Committee, especially with respect to health aspects in the American Rescue Plan that is coming our way. And I really appreciate this community. Congressman appreciates how you are fighting for the Build Back Better plan, which offers us even greater capacity to get to more people, especially in a state that does not have the Medicaid, Medicare expansion, Medicaid expansion that is so critical and so many states are using, and my tax dollars are helping to pay for people in just about every other state than my own state. And I just really appreciate that work. Councilmember Casar, thank you. You are one of the most significant leaders this community has in bringing economic security, access to health and to housing that we have in this community. Thank you for your continued championship of that. Affordable health insurance is a key component of equitable life in our city. No member of this community should have to make a choice between paying for health care, child care, putting food on the table, supporting the work of the Health Alliance for Austin musicians. We have musicians that throughout our city that are core to our culture. But especially as we go through the pandemic we just went through, where are those folks supposed to get assistance and work? It is programs like the one we're talking about today that enables HAM to be able to do its work year-round in our city, that preserves the quality of life that we all enjoy in our city. 21% of Texans live without any form of health insurance, and that is criminal in a day like we have here today, especially after we've seen the importance of access to health care in our community as we've gone through this past pandemic. You know, if there was ever a moment in time when it was impossible for us as a community to look away from the people in our community that did not have the shared access to health coverage, it was this time we just went through. Coverage has never been more affordable. As you heard, there are 162 plans to choose from, And foundation communities can walk anybody through what is not a terribly complicated process, but it becomes really simple when you walk in this door for anybody that wants to be able to access that. Obviously, Congressman, we want the $165 billion in the Build Back Better plan to expand it, and we should all be reaching out to everybody we know in Washington to help push that effort through because it is critical, and that includes the rest of our congressional delegation. And I want to conclude with this. We have a lot more people in our community right now that are not employed by employers that provide health care protection. We have a lot of people who don't have the jobs they had a year and a half ago. We have employers that are not employing the way that they employed a year and a half ago. This is how our community helps ensure people that don't have those ties. This is how people in our community that find themselves without health insurance provide health insurance for themselves, their partners, their spouses. This is how people in our community protect their children. It is so easy when you walk in the foundation community doors. 45,000 people have been assisted in our community. It is an easy process. We want everybody to take advantage of it. And with that, I'm going to go ahead then and turn the dais over to that champion for health access and health care in our city, my colleague on the council, Councilmember Greg Casar.
Good morning. I'm Councilmember Greg Casar, and I'm going to be giving most of my remarks in Spanish to our immigrant and Latino community. But I do want to start out by thanking Foundation Communities for everything you do for housing and healthcare, thanking our musicians and all of the staff that have put this together, thanking you, Mayor, for your hard work leading us through the greatest public health disaster our city has seen in at least a century. And thank you, Congressman Doggett, for fighting just time after time after time, proposal after proposal, to expand healthcare access, because healthcare should be a right, not a privilege. And it is days like this and organizations like Foundation Communities that make that right real for people. And so I just appreciate what you are doing to make that right real for everyone. We've done this year after year, every year, letting people know about open enrollment, but this is the year where there are finally so many more dollars on the table and so much more help so that people can get the healthcare access that they need. Entonces quiero que toda la comunidad venga a Foundation Communities para inscribirse. Ahorita es el momento, entre hoy y el 15 de enero. Hay más dinero y hay más programas que en cualquier otro año. No solamente escuches a lo que oíste de tu compañero de trabajo o tu familiar o el año pasado, porque este año hay nuevos planes y nueva ayuda para la comunidad, para que tú y tu familia tengan la cobertura del seguro médico que necesitas. Vimos dentro de esta pandemia qué tan importante es tener un buen doctor, tener acceso al seguro, y aquí hay ayuda para que haya un plan accesible, un plan a un precio accesible. Y aquí en Foundation Communities hay un equipo que trabaja siempre con nuestra comunidad inmigrante, hispanohablante, ayudarte a navegar el proceso para que puedas escoger el plan que sirve para ti y tu familia. Pueden ayudarte a escoger uno de los planes para que sea específicamente para tu familia. Ahorita está abierto. Busca Foundation Communities, llámales por teléfono. Hay gente que aquí que habla español y son parte de nuestra comunidad. Entonces, por favor, este año hay más ayuda, es más dinero para tu comunidad, para tu familia, y la cobertura del seguro médico que necesitamos en nuestra comunidad. Gracias.
All right, thank you, Councilmember Casar. So now we want to bring up our musician friend, Alejandro Rios, is going to tell us a little bit about his experience. So thank you again for the great music, Alejandro.
Ooh, man. Well, it is an absolute honor, first and foremost, to be able to speak in front of all of you and to speak on behalf of HAM and Foundations Communities, Sendero Health, Central Central Health's contributions to all they do for the music community here. And as I'm sure everyone in this room is well aware, is how absolutely beautiful and crucial HAM and foundations communities are to the community, especially the music community. They're a total lifeline for us, and they definitely help us be able to focus on the career path that we've chosen, and not just be totally burdened with a mountain of debt or, confusing healthcare, because it can be overwhelming for a lot of us, and make us not want to approach healthcare because it's expensive. And if they weren't here for us, then we wouldn't be able to take care of crucial needs, like, especially in my case, I had to take care of a massive brain surgery that if I had not taken care of it, especially during the pandemic, I would have been paralyzed. And the condition was known as Chiari Malformation. So essentially my skull was too small for my brain. I know it sounds ridiculous, but that's how it is. And what was happening was the base of my skull was pressing against my cerebellum and redirecting the flow of cerebral spinal fluid into my spine, making a syrinx, which is essentially a cyst. And obviously there's not supposed to be a cyst in your spine, but it was pressing against the spine and affecting my nerves. Like, for years I've had weird pains in my arm, and obviously as a guitar player, this is where all the soul comes from. But it's a surgery that I knew I had to do, and prior, I'm 27 currently. I was 26 and I was still under my father's insurance. And I was like, okay, I want to take care of it now. But then my band, Black Odyssey, we went on tour and I wasn't able to take care of it. So I approached 2019 very just uneasy. I'm like, I know I need to take care of this, or I won't be able to take care of anything. And I was like, well, I always hear amazing things about HAM, and through HAM I've learned about foundations communities, and I always heard wonders of them, so I signed up. And they're just, organizations like that are huge blessings and make me believe in, the power of community. And, especially with foundation community, we're in a center called the Prosper Center, which they want people to prosper and take care of this and take advantage of this. So, during the pandemic, I was able to take care of that surgery that I needed so bad. And, thanks to St. David's and foundations communities, and I'm here today, able to still move around and feel good. And honestly, that would be not possible if it wasn't for organizations like this that are helping musicians be able to stay strong and creative. And I'm just very, very, very grateful for everything that they do for the community. And I'm excited to be doing another year. This is the time to sign up while it's hot. November through January. It's super easy. Each year, like, it's not a burden to look forward to it, honestly. Like, it's a really compassionate team of people that want to help you, take advantage of these resources that are available. And all you got to do is just set up a phone call and set up a date. Mine's November 29th, so the day after my birthday, I'm November 28th. So I want to say this is a gift from HAM and Foundations community. Thank you. And if for any musicians or anyone that's listening, definitely take advantage of this. Call, it's super easy. I assure you, you can reach out to me. I'll help you. But mainly you can go to prosperhealthcoverage.org and sign up, and then set up open enrollment and keep living.
Thank you so much, Alejandro, for sharing your story. That was awesome. Thank you. So now it's my great pleasure and honor to introduce our congressman, a longtime friend of Foundation Communities, Representative Lloyd Doggett.
Thank you, Julian. Fortunately, I'm not here to either sing or dance, but I am very happy to live in the live music capital of the world. And what many of our neighbors don't realize is that the musicians that make this the live music capital of the world, just like Alejandro and Drent, are basically small businesses. And if they had to go out and get health insurance on their own, it might be prohibitively expensive for their business. But through HAM and through foundation communities and through the Affordable Care Act, they can get the coverage that they need to be able to continue performing. And the story we just heard from Alejandro really is the kind of story that particularly many of the younger members of our community sometimes don't appreciate. That they're just one diagnosis unexpected like he had, or a traffic accident this afternoon away from needing comprehensive health care. And so that's why we're here today. And I appreciate Julian, I appreciate Corey Hattemer back here who runs the Prosper Center. I've been doing these affordable care events with them now for over a decade, and even longer before the Prosper Center existed, in working on the Earned Income Tax Credit and the Child Tax Credit. A few weeks back, we had an event here on the Child Tax Credit. That's $300 per child for many children in families. That assistance is available right here. But the security, not only income security, but health security, is what Foundation is all about. Mayor Adler, Councilmember Casar, who've been such strong advocates for better health care here. Our goal this year, my goal, my top priority, is to see that unfortunate distinction of being the most uninsured state in the entire country comes to an end. And we're about to do that with the Build Back Better legislation. The most immediate benefit of what we're talking about today is that anyone can come right into this Prosper Center or through the virtual Prosper activities and get free help. Even if they have a health insurance policy now, they can get free help on whether the changes and the new policies that are available are better for the coverage for their family. This is, as Julian said, this is a good news conference, because while we've gone through, Mayor, year after year, the obstacles, the sabotage that the Trump administration tried to undermine this bill, this year there's more help available through Foundation than ever before in the course of the last decade. There are many people, because of the increased tax credits that we approved back in the spring in the American Rescue Plan, who will find the same plan they had last year, even though other prices are going up, the price that they will pay for their premium is going down because of the increased tax credits. And a significant number of people will find that for the first time, they will pay no premium at all to get the coverage that they need, because we've tried to improve and strengthen the Affordable Care Act coverage for many working families who are economically disadvantaged. As far as where we go from here, next week, I believe that the House will approve the Build Back Better legislation. And in it, for the first time, we will overcome all of the obstruction that we've had for more than a decade down at the Texas legislature and with Republican governors. And we will add we will provide an opportunity for the 2 million Texans who have gotten no benefit out of the Affordable Care Act because they were too poor and the state neglected them for a decade. They will be offered marketplace plans also. And we will be back here in January when I believe that will become effective, so that those working Texans who've been left out and left behind will find that they finally have coverage, and we can add to the good work being done here with the increased tax credits under the American Rescue Plan. The same legislation next week will also continue these enhanced tax credits for future years, for the next 4 years, so that we can maintain the policies that are being purchased here, and will provide other critical health care improvements. So it's a good news conference with good music and good opportunity for our neighbors to come in and sign up. There are, year after year, there are families that move into our state or have been here and are trying to make ends meet with multiple jobs who don't see the opportunity that is here. And that's why we have gathered with good news to remind each of them of the importance, as we approach the Thanksgiving season and the holiday season, of giving thanks to your family by assuring that everyone in it, every child, every member of the family, has the best health care coverage that they can get. We talk about coverage and access, but this is really about, do you have a family physician? Do you have a pathway to get the essential medicines that your family may need? Do you have access to mental health care and other kinds of health care services? All of this can come about by the simple act of signing up under the Affordable Care Act, an opportunity that come January, I hope we make to millions more Texans. Thanks a lot. I think we're ready for your questions. We got the experts here. Are there any? Julian, you may want to take these.
I'll try.
Yeah.
Any questions anybody has?
If not, we will stay around for individual questions, and we'll refer all the tough ones to Alejandro, since he did the best job of explaining it. Thank you. Thank you very much.
Thanks, everybody.